Welcome to Living Well with Sigma Humans, the podcast where we break down the biggest challenges in the medical world today and explore innovative solutions shaping the future of care. Today, we're tackling an issue that affects not just patients, but the very people responsible for keeping us healthy, our physicians and healthcare providers. The U.S. is facing a severe physician shortage, and with it, a rise in provider burnout. Hospitals and clinics are struggling to keep up with demand, and patients are feeling the effects. Longer wait times, rushed appointments, and a system that's stretched too thin. But what's really behind this crisis? And more importantly, is there a better way? Let's dive in. To understand the scale of this crisis, let's look at the numbers. According to the Association of American Medical Colleges, by 2034, the U.S. could face a shortage of up to 124,000 physicians. That's right, 124,000 doctors, fewer than what we need. But the issue isn't just about numbers, it's about workload. A recent survey found that nearly 60% of physicians report symptoms of burnout, citing overwhelming administrative tasks, excessive patient loads, and a lack of work-life balance. Physicians are leaving traditional practice, some retiring early, and others opting for non-clinical careers. That means fewer doctors available to see patients, leading to long wait times and reduced access to quality care. Now let's talk about what this means for everyday people. Imagine needing to see a doctor for a chronic condition or a sudden illness, only to find that the next available appointment is months away. This is becoming a reality in many parts of the country, particularly in rural and underserved communities. The average wait time to see a primary care physician in some cities has jumped to over 26 days, nearly a month just to be seen. For many, this delay leads to worsening health conditions, reliance on urgent care or emergency rooms for non-emergency issues, and higher healthcare costs overall. This system isn't sustainable for patients, and it certainly isn't sustainable for doctors. Let's step into the shoes of a physician for a moment. Doctors enter medicine to help people, to heal, to guide, and to make a difference. But today's reality? Many spend more time clicking through electronic health records than actually engaging with patients. A typical primary care doctor sees 20 to 30 patients per day, often with only 10 to 15 minutes per appointment. Add in administrative burdens, insurance paperwork, government regulations, and corporate oversight, and you've got a profession that's losing its heart. Studies show that nearly 1 in 5 doctors plans to leave clinical practice within the next 2 years. This is not just a workforce issue, it's a public health crisis. If the traditional healthcare model is failing both doctors and patients, what's the alternative? What if we redesigned healthcare so that doctors could focus on what they do best, caring for patients, without the barriers that drive them out of the profession? That's where a shift in care delivery comes in. Imagine a healthcare system where physicians have more time with patients, not just 10 rushed minutes, but real, meaningful interactions. Care comes to the patient instead of making sick, elderly, or time-constrained individuals travel to overcrowded offices. Technology bridges the gap. Telehealth enables quick, efficient consultations without unnecessary in-person visits. Burnout is reduced because providers can practice medicine in a way that is fulfilling, sustainable, and focused on patient outcomes. This isn't a distant dream, it's already happening. A growing number of physicians are stepping away from traditional clinics and embracing patient-first care models that prioritize both preventive medicine and provider well-being. And the results? Better outcomes, happier doctors, and healthier communities. So what does all of this mean for you? It means that healthcare doesn't have to be impersonal, overburdened, or inaccessible. It means that new models of care, ones that bring house calls, telehealth, and preventive medicine to the forefront, are paving the way for a better experience for both patients and providers. Doctors deserve to practice medicine without burnout. Patients deserve care that is convenient, accessible, and personal. And together we can move toward a system that makes both possible. If you're someone who's struggled with long wait times, impersonal care, or the frustration of navigating today's healthcare system, know that change is happening. Solutions exist that bring healthcare to you without the stress, the wait, or the red tape. If you want to learn more about patient-first healthcare solutions that prioritize your well-being, call us today at 773-900-7182 to schedule an appointment, or visit us at sigmahumans.com to explore how modern medicine is evolving to put people, both doctors and patients, first. And if you found this episode insightful, please subscribe and share it with someone who needs to hear it. Until next time, take care of yourself and your health.